So youth in our community has a new focus of JFCS, and this all went into the decision-making for this year's discussion. So why begin with the internet and social media? There's a growing body of research on this topic, and it's a topic that those of us who are parents have angst about on a regular basis. There's a longitudinal study from Canada that correlates the growing rates of depression and suicide in youth with the propagation of cell phones in North American culture. Last year, the US Surgeon General, Dr. Vivek Murthy, issued an advisory about social media's impact on youth mental health. It notes that while social media can provide benefits for some children and youth, there's growing research about potential harms that social media poses. More specifically, the National Institute of Health has a recent research publication that connects excessive and problematic use of social media with increased mental health issues such as depression and anxiety in our youth. So with today's panel, our goal is to talk about some of these risk factors, identify preventative strategies, and talk about some potential interventions. We also want to take a moment to dispel some of the common myths that we have about the risks that are out there for our kids. In short, the internet and social media are not going away, nor should they. In the face of these risks and realities, how do we continue to build resiliency in our youth? What do we as peers, as parents, as caregivers, and as communities do to support youth in a way that leads to a responsible and supportive future? This mirrors a JFCS stated vision, which is how do we build a stronger Louisville for everyone? With that, I'm going to turn and introduce our panelists. Starting closest to me is Annisha Dunaway. Ms. Dunaway is a licensed clinical social worker and Army veteran. She currently serves as a victim assistance program specialist for the Homelandsecurity investigations. Her area of responsibility includes the Commonwealth of Kentucky and also Hawaii for those of you who are looking for vacation places, and assists in all states as needed. Ms. Dunaway has worked in forensics, serving individuals who have experienced trauma, as well as military personnel. Dunaway has experience as a clinician providing therapy to identified sexually violent predators and has worked assessing individuals to determine their suitability for trial, as well as their risk for suicide in jails. In her current role as a victim specialist, Ms. Dunaway responds on the scene with Homeland Security investigation special agents to assist in federal cases which involve a victim. This work includes working on cases in which the victim is a youth who has been exploited online. Ms. Dunaway assists agents with a trauma-informed approach and helps make notifications to parents and guardians when a minor is identified as a victim, and provides support, including explaining the investigation process, and assists in helping families identify resources. Thank you for joining us, Ms. Dunaway. Next is Dr. Sarah Rose. Dr. Rose is a licensed psychologist and has been with JFCS since January of 2022. She earned her master's and doctorate degrees in clinical psychology from Wheaton College, with an emphasis on child and adolescent treatment in trauma-informed care. At JFCS, Dr. Rose specializes in providing therapeutic services for youth and their families, especially with regard to relational challenges, mood disorders, trauma, and other adverse life events. She also conducts psychological assessments for youth with histories of trauma, consults with state and court agencies throughout the Commonwealth regarding treatment needs for those youth and their families, and supervises and coordinates our psychology training program at Jewish Family and Career Services. Thank you for joining us, Dr. Rose. Next, in order, they switched the order, Next is Sonja Gray. Ms. Gray has been the executive director for Exploited Children's Help Organization, also known as ECHO, since 2016. ECHO's mission is dedicated to preventing and reducing the incidence and impact of child abuse by providing education, advocacy, and support services to the children and families in Metro Louisville. Her role as an executive director is very active in the community as she partners with nonprofit organizations, local schools, and youth-serving organizations, all while serving in different leadership roles. Ms. Gray is a graduate of the University of Kentucky. She has previously served as the executive director of the Louisville Economic Chamber of Commerce and worked at Exceptional Teens and Adults Incorporated, as well as Big Brothers Big Sisters of Kentuckiana. She has served in leadership roles in numerous organizations throughout the community, effectively raising awareness and support for various causes. Her civic and community involvement is immense, and she's an individual who works with enthusiasm and passion in everything she does. Thank you for joining us, Ms. Gray. Next is Rachel Mattaline. Ms. Mattaline is a licensed clinical social worker who graduated from the University of Louisville's Kent School of Social Work in 2014 with a Master's of Science in Social Work, specializing in substance abuse. Ms. Mattaline has worked with pregnant and parenting women with substance abuse disorders, as well as teens with substance use disorders, and children and families with various diagnoses. Ms. Mattaline works at the Pediatric Integrated Behavioral Health Provider for Norton Children's Medical Group on Broadway, where she serves individuals whose ages range from 2 to 21. She serves individuals who struggle with social determinants of health, such as adverse childhood experiences, housing, education, and employment. Ms. Mattaline has been employed with Norton Healthcare for 5 years. When not serving her community, she enjoys playing sand volleyball and being outside with her dogs, Nico and Zoe. And thank you for joining us. I'm going to break down the formalities when we move forward and refer to you all by your first names, and I hope that's okay with you. For those of you who've been to our prior community chats, we're doing this one a little bit differently. We will, as always, we will hold time at the end for individual questions. But I want to mention a couple of other pieces. One is that the topic that we're covering tonight can sometimes be a triggering one. It can sometimes create some strong reactions. So if that's your experience, you should feel comfortable stepping out if you need to and taking a break. And I just want to make you all aware of that as needed. In addition to that, when we do have our questions at the end, we have 2 ways that you can ask questions. Anybody in the audience will be allowed to ask a question. In addition to that, at your seat are a couple of flyers, and I'm going to talk about some of the others in a moment. But this flyer that has a QR code is so that if you have a question that you would like to ask, but you're not comfortable either providing your name or asking it in this forum, you can post that question online, and we will still be able to address that question at the end of tonight's event. Now, I'd like to go ahead and start some questions for our audience, for our panelists. And as we do that, I also want to mention to you all that if you've noticed, I've already been talking about the internet and social media, and I really haven't been talking about the dark web. The reason for this is that the decision that we as panelists made, and kind of really the original idea of this presentation, was to make sure that we were focused on the threats to our community that we know of and that are common and are out there. And as we talk about myths, really the dark web is one of those in terms of threats to our youth. It's a little bit of a myth because most of our youth actually don't know how to access the dark web. What they do know how to access, and they do access on a regular basis, is the internet and social media. So to start off, I'm going to ask Sonja, you to talk about some of the platforms. Again, this is sort of a level setting for the audience, for old people like myself who don't know about social media and aren't great with social media. So I'm going to ask you to go ahead and talk a little bit about the different platforms on social media, and some have different risks than others.
Okay, not a problem. First off, thank you so much for allowing me to be here. I'm humbled by this experience and opportunity. So one of the things that I'm going to share with you is we work with kids and we go into the classroom. So we are privileged to learn a lot from the kids. And if you think that kids are on Facebook, I'm just going to let you know they say that is for old people. And so I'm assuming that they mean anybody that's probably like 25 and up, considering for them being old. But, you know, it's wonderful for us to be in the classroom because we create an environment that is safe for kids to be able to advocate and to speak up and really to share a lot of information with us. Most of these platforms you all probably are familiar with, but I'm curious to know how many of you all have actually ventured into some of these apps. And so some of the apps that may be familiar to you is Snapchat. That was a really big one when it came out on the platform. And the whole idea of Snapchat when they were launching this is that you can distribute information and then it will go away. And that is not true. One of the things that we talk to kids about is anything digital footprinting, anything that you do on electronic devices is always traceable and trackable. So Snapchat is one of those, again, where you want to make sure that you have parental controls. If you have not had the opportunity to talk with your children about what type of apps that they are on, this is a great time to start talking with them about that. Another one that you may have heard about is, which is called X now, but that was Twitter. We see a lot of adults that participate with Twitter, and now it has become X. And the third one that I'm going to mention is going to be another one that is most familiar to us is also TikTok. And, you know, national news, TikTok has made national news just about the impact that it does have with children. And again, for any of these apps, there's always parental controls, but what we see a lot of times is that adults and caregivers are putting these devices in children's hands without having a conversation about the dangers of what can happen. Most all of these apps have an opportunity where you can have a chat room. And as they try to set parameters, they are not that strong, which means that kids can have the opportunity to talk to strangers, and strangers have the opportunity to talk to kids as well. Now, I'm going to share a couple of apps that you may not know about that the kids are using. One was called Omegle, which we are very familiar with. And since then, Omegle has been taken down. But I will say this about apps. As soon as you learn about an app, this is a very fast-paced environment. So as soon as you learn about one, the kids have already went to another one, or it's going to be taken down. The Omegle app, what was very startling to us is that as soon as you get on this app, the landing page said, "Do you want to talk to a stranger?" Now, I had the opportunity of being at another conference with Ms. Dunaway, and we had the Kentucky State Police to bring that app up. And he identified himself as a 12-year-old child. And I'm talking about within seconds, people were responding. And then in a few minutes, the conversation started changing and asking very personal questions. Another app that you may not be familiar with that is like on the hot circuit right now for kids is called Monkey. And Monkey is another app that you're able to share information. All these apps, when it is presented to kids, it's like a fun, engaging, type of thing that you can do. And it can be fun. Only if we have talked to our kids about what the precautionary methods are in case that they run into content that is unfamiliar, if they happen to have a stranger that reaches out to them and starts asking them for personal information. So a lot of these apps, as I said, we have probably a 3-inch ring binder with just apps alone. But as I mentioned, as soon as one goes down, there's another one that miraculously, evolves. For the ones that I have mentioned, I will say that we do have some information on our table back there. But the main thing that I can say is ask your kids, what are they utilizing? What are they using? Now, I know this is going to be difficult because they may and may not share with you, but it's an opportunity to have that conversation and really talk about the safety of how to remain safe in that digital space.
Thank you, Sonja. And I'm going to come back to some things that you mentioned in a minute and give that to Rachel first in a second. Before I do that, Annisha, would you mind kind of educating us a little bit about when Sonja was talking about the risks, sort of how you become aware as Homeland Security investigations? What are the steps? And are you the first people to find out about it? How do you find out about it? Are parents comfortable waiting for you to knock on their door? Let's talk about how that happens.
I think I'm pretty nice, but I would say that most parents are probably not so welcoming when we come and knock on the door. So most of our tips come through either the platforms themselves. When youth are identified as being minors, they're flagged, or it's mostly through NCMEC, so National Missing and Exploited Children. Sometimes they have where previous pictures have been kept. Once they start being traded or passed along, we get a tip about a picture that's possibly out there. Or it's through another law enforcement investigation where we're coming through at devices such as a cell phone or a laptop, and we come across images. HSI has a great group called C3 that really do sit there, and I would say their intelligence level is off the chart, that they're able to sit there, look at a picture, and look at the background, and they literally were able to find a child and identify them off of a fish and off of a restroom that was in the background. But that takes a lot of time to sit there and to identify a child. So it's usually not through the parents coming across a picture or the child telling them, it's through law enforcement being notified through a tip another way. Once we are giving that notification and we are able to identify a youth, an agent or law enforcement, local police will go out. Sometimes it's either to a parent or a guardian, or sometimes we use school resource officers or a guidance counselor, and we will show them an image. It's going to be a sanitized image to say, do you recognize this youth? And when they do confirm, we will contact the parents or the guardians. And at that point, it's one of those things where I'm brought in, and I will assist the agent and to explain to them that the youth has been identified, and we would like to speak with them, possibly about it.
Thank you. So let me circle back for a moment to the social media as something that kids benefit from and enjoy, but that sometimes it can be too much. And so, Sarah, I'd like you to talk a little bit about experiences you've had working with youth where their use of social media may not be to the point of exploitation and requiring law enforcement intervention, but even creating issues within the family or issues within that youth.
Yeah, absolutely. So I would say pretty much every single youth that I work with is on social media. It's something that is how they communicate with their friends, sometimes even with family members. But a lot of times what I will see is youth sharing pictures or sharing personal information, things that feel very vulnerable to them with trusted friends or trusted peers, sometimes even in the context of a romantic relationship, feeling that that's a safe space. And then suddenly those things get shared with other peers or other individuals in their circles. So someone might come to school and find that something that they shared privately with someone now is something that the entire school has access to. And I would say that most commonly that's happening with pictures. And it feels like a trusted situation. It's a peer that they feel connected to, or sometimes even like friends of peers, so kind of that one distance relationship removed, but something where they will share it, and then it becomes a piece where there might be bullying that's happening online and in person. It feels very isolating from their family and their friends. We see a lot of depressive symptoms as some of the studies that David was mentioning earlier. We can see some social anxiety and then just a lot of relational conflict that happens. And another pretty common thing as parents start to find this out, it can create some conflict within the family and feel like some ruptures between the parents and the children, and trying to navigate these things where the parents feel like they can't trust the child, but the child wants their freedom and wants their independence, and it becomes this power struggle. So you see a lot of that conflict coming into the therapy space as well.
So, Rachel, when we talked on Monday, and so this is kind of pulled together a little bit of the last three conversations, you had talked about a contract that sometimes you do with parents and families related to internet usage. Can you talk a little bit about
Sure, absolutely. A lot of times in my therapy sessions as well, I get parents that say, I can't get my teenager especially to do anything, right? They're not doing their homework. They're not doing their chores. It's like they're not even listening to me. And that's when I typically develop a contract in session. It can be called a social media contract, an electronic contract, anything really that you want to call it, a family media plan. But basically, we get the parents to sit down with their children and create a set of rules around how long we can be on social media or electronics, what apps we can access, what specific terms we can use in texting, so if the word sex comes up, that might be a yellow flag for parents, and then they can talk to their children about that. And we also, in the contract, typically recommend that parents talk to their kids about what time all of these things should be shut down. American Academy of Pediatrics recommends really that we cut off all electronics 1 hour before bedtime. And there are a lot of studies that are showing 7 to 12-year-olds are on social media 3 to 5 hours per day. And then 13 to 18-year-olds are in the 8-hour range. And that is with a full day of school. So imagine that and what it's doing for their brains, their bodies. A lot of my kiddos are coming into the clinic with sleep issues. The biggest thing that we're finding in clinic is that kids are not getting enough sleep, which is directly impacting their development. That impacts communication, that impacts grades, that impacts social relationships, personal relationships with parents even. So we are finding that creating a family plan kind of holds an agreement, basically, with mom, dad, and a child, or a guardian and a child, to say, these are the rules. And if the rules are broken multiple times, here are the consequences to that. And typically that is taking the electronic away.
Thank you. So let's take even one step further back and talk about prevention piece. And I realize in some ways you are talking about prevention because contracts can be a preventative method.
Absolutely.
Before we jump into that a little bit more as well, though, Sonja, I'm going to ask you to talk a little bit about the work that ECHO does in schools and what advice, because in addition to working with schools, you also work with parents. Mm-hmm. And what advice do you give parents when you're doing your trainings to talk about safe online use?
Yes. So ECHO, we've been around since 1983. And actually, we evolved as an organization due to an incident here in Louisville with a 12-year-old girl who was riding her bike over by Bashford Manor Mall. And unfortunately, she was never found, and that was Ann Gottlieb. And so we started out as really, our whole mission was to find missing kids. But with that, we evolved into the exploitation of children as well. And so our organization now, we are one of the only organizations that partner with public and private schools, and we go into the classroom and we empower and educate the kids about body safety and internet safety. It is a comprehensive approach so that we can talk about both, but the curriculum that we utilize is through the Monique Burr Foundation for Children, so it's evidence-based and inform-based. One of the things that I was very specific about when working with kids and in the classroom is that we need to make sure that they can see us many times, multiple times, so they can identify us as safe adults. So once again, we create these safe spaces that if their safety has been compromised, that they certainly can speak up to any of us. We also wanted to make sure that, this is a sensitive subject and topic. So we know the dangers. We don't want to put, the scare tactic on kids, but more importantly, engaging with them in a fun way that they're going to learn and be able to grasp concepts. And so our whole safety foundation is based on 5 safety rules. And in the classroom, we talk to the young kids. Our program is pre-K through 12th, and it's all age appropriate. So obviously what we talk about with 8th graders is a little bit different as we speak with the 1st graders. But the concept is the first safety rule is knowing what's up, knowing your personal information, knowing your mom's information. It is amazing to me that, it's not amazing because actually it's technology that has helped us, that we don't have to remember phone numbers. But we are in the classroom talking to kids about you need to at least know 1 phone number. If you don't have any type of devices or anything like that, that you have memorized something that if you're in an unsafe situation, you know how to call someone else outside of calling 911 as well. We also, safety rule number 2 is spotting the red flags. So we help kids be able to identify what red flags are. anything that makes you feel uncomfortable, people that may come up to you. We talk about what does a stranger look like? And that's also a very interesting conversation because one of the pictures that we show is like a mom, and another is like a man. And of course, usually, the stranger is the man. And so we also help kids to identify what strangers may look like and talk to them about tricks as well, because we know that perpetrators like to trick children. The third one is once you identify what some of those red flags are, we want you to make a move. And that is getting away from that situation, going to a safe space and staying in that space until a safe adult is there with you. And then fourth, we talk about talk it up. When it comes to child abuse, there can be a lot of shame that is related to child abuse. For some kids that have been abused, they may not want to get people in trouble. They may feel like it was their fault. And so within the classroom, we give them the permission to say that it is okay to talk it up and speak it up and make sure that you identify that safe adult, because that safe adult is going to be that advocate for you. And then lastly is the safety rule that we really like is no blame, no shame. Once you have spoken up, we are not going to shame you or blame you. So that's a little bit about what we talk about in the classroom with our kiddos. As far as with the adults, mainly what I talk about is making sure that you are creating, like you said, boundaries, creating some type of plan, some type of contract, so we all know what the rules are. We all know what the regulations are around this internet. The biggest thing that I always say with parents is open conversation. I grew up in a time where, and I say this in trainings all the time, where kids were to be seen and not heard. And I always say, I always had something to say. Our kids have a lot to say now because they are influenced and impacted by so much information that we have to start creating safe spaces for kids to be able to communicate. And we as adults, we had to check our emotions.
So I have a question about that for the other panelists as well, and I guess probably this is mostly a Sarah and Rachel question, which is that how do you have that conversation? Does that conversation change whether you're having that conversation? I think the statistic that Rachel, you said was 5 to, as young as 5 or have access to social media. So how is that conversation different with a 5-year-old or 8-year-old or 12-year-old or 17-year-old, right? Thinking about the significance of social media at those different age groups and developmental needs. So whoever feels the urge to jump in and help each other out with these answers, because it's a lot. So whoever wants to go.
Sure. Excuse me, I'll jump in. I think when you were talking, Sonja, the first thing that popped into my head and I wrote down was generational trauma. I work downtown on Broadway, and I work primarily with low to middle class population. 95% of our patients are on Medicaid. When families come to me, a lot of times it's because they don't know what else to do and where else to turn. And I have parents coming to me all the time saying, I wish my parent would have given me this space to share with somebody who is trusted, who is safe, to open up about things. Generational trauma, specifically sexual abuse, unfortunately, happens when people don't talk about it, okay? So typically when I have a parent coming in and saying, I was sexually assaulted by a family member, but I was told never to talk about it, it can continue, right? And I don't want my child to ever feel like, if somebody is unsafe, if there's a red flag, that you can't come and talk to me, okay? And that's the biggest thing for me. Adverse childhood experiences, I could go on and on about the study and everything with ACEs, but bottom line is, to prevent generational trauma from happening, we have to talk. We have to talk to our kids about what has happened to us, what we have learned from our own experiences, but doing that in an age-appropriate way. So of course, it's going to be different for littles versus teenagers.
Well, and specifically, I'm thinking about, I'm an old man, and I go and talk to my 20-year-old about what communication was like when I was 20.
Sure.
Right? We
Sure.
didn't have cell phones when I was 20, right? I typed on a typewriter in college. My kids don't know what a typewriter is. So
Right.
so it's beyond that. So I don't know, Sarah, if you want to.
Yeah, so I think when we're talking with elementary school, especially early elementary school kids, we are setting much firmer boundaries in those ways that we might be actually like fully limiting access to social media, or we're talking in much more concrete terms because that is where they're at developmentally, kind of being able to understand the nuances of things or think a little bit more abstractly, or even talking about like impacts of the future isn't going to land quite as well with younger kids because they don't have that ability to talk in that way or to think in that way. When we're talking with older youth, they have a little bit more independence. They have those more abstract reasoning skills. We're talking about the future. We can have a lot more of those kind of real life conversations of like, what does this mean for you going into a job, that these things might be following you, or how does this look like? We're not going to have that conversation with a first or second grader, that we want to break it down in terms that they're going to understand. And I think someone had mentioned before too, making sure we're not using scare tactics, that we really want to be connecting with our kids, having that open conversation, and making sure it's something where the parent's own emotion isn't leading the conversation. So part of it too is making sure that as parents, we're aware of our own reactions to this. We're aware of how we feel, if we're afraid, if we're angry, that we're able to manage those emotions and really be in a good space for ourselves to go and approach our children and having those conversations.
And there are a ton of books too, body boundary books especially for younger children that you can get on Amazon or at the library that talk about age-appropriate ways to talk to your children about boundaries, space.
Yeah, and I was gonna jump in because you're asking like, how do we start the conversation, right?
Let me pause you for a second because I'll preface this by saying I started my career working with victims and perpetrators of sexual violence. So I am not afraid to talk about sexual abuse. However, I would love for somebody to speak to, when we talk about sexual abuse, what percentage of kids that are online are sexually abused versus what percentage of kids that are have problematic social media use, have anxiety or depression or poor social relations. So I bring that up to say that while a conversation about sexual abuse is absolutely critical, I think we're also talking about kind of kids who are not sexually abused and how social media, overwhelming uses of social media can direct that in a poor direction.
Yeah, so one of the ways that you can start, if you have younger kids, is ask them, just ask them a question. Do you know about TikTok? Do you know about Snapchat? You can ask them, and if they already have phones, they probably have an account. You can ask them about how many social media accounts do you have? Which is another interesting question because most kids have 3 to 4 accounts under one app.
Or different usernames.
So that is one way that you can begin the conversation about the internet. You can ask them, have you ever seen anything that made you feel uncomfortable? That starts opening up the doors for conversation. With the older kids, we also want to talk about consequences because at that point, we're starting to talk about sextortion. And with older kids, you can ask them questions around, do you know, and what I always tell parents is always act like you don't know because then that's when they are going to let you know that you don't know. So ask them terms about digital footprinting. I heard this term about digital footprinting. What is this? We had some guides at a training last week, and it was about Snapchat. And I just went up to the little boy, and I said, I don't know anything about this Snapchat. Can you tell me something about it? And he just started rambling off. So those are some easy ways to start the conversation and having open conversation. One of the things that I will say is that when kids start sharing, do not interrogate them, because then they will stop sharing with you. So a great thing that we always say is for parents is, if you're curious, tell me more. Tell me more about that. I heard about this, or I've seen this. How does that make you feel? That's another great question. When we have a lot of violence that we see on TV, on internet, through gaming sites, games and all that, we can ask kids, how do they feel? Because we are seeing also a lack of empathy. And I don't know if, our therapists here can speak on that, but we're also seeing where there's a lack of empathy for children because they're not talking about their feelings.
So actually, that's a great question for the two therapists. And before we go to that question about empathy, you mentioned the phrase digital footprinting.
Yeah.
I told you that I'm old. Will you explain to me what digital footprinting is?
Yes, and I also will say that you all are so great that you all put these definitions on your little flyer, so check that out. But one of the things, we are all unique with our own fingerprint. We all have our own unique fingerprint, and as well as in the internet space, they call it digital fingerprinting. So every device that you use, again, is traceable and trackable. And Ms. Dunaway probably can even speak louder about that, about how they find it on the back end. But everything that you do in this digital space, somebody can see it. It may not be us, but there are people that are very well educated of knowing how to pull that information. A lot of times we all have IP addresses, and so you're able to track a lot of information through those types of sites as well. But one of the things that we tell our kids is once you put it out there, once you hit send, you no longer have control over that information. It is out there in that digital space.
So thank you. And let's go to the empathy question, because you hear about that a lot. You hear people say that youth today don't work as hard, they don't care as much. There's a lot of dispersions. Are youth less empathic? And how do you connect that to social media usage? Like that?
So I would say one of the things that I think happens a lot with social media use, especially if we're spending 5, 6, 7, 8 hours a day on social media, is that we're not getting the opportunity to practice social skills with other people. So it's not necessarily like lacking empathy as a whole or lacking the ability to have it or to talk about feelings. It's that we're not getting the practice in doing that with a real live human across from us. The amount of information that we get sitting across from somebody with their facial expression, their body language, their vocal tone, all of those things don't come across the same way with social media. We see it where, you might see a bunch of teens out in the mall or at the restaurant together, and they're like talking to each other via apps while they're sitting right next to each other. And so they're not getting that practice of going back and forth with somebody. And so I would say that's a huge limit to being able to display empathy or really connect with another person when they're given that opportunity. And it happens a lot with families too, of everybody sitting at the dinner table, sitting on their phone, or coming home and everybody goes into their separate spaces and will be watching a movie, everybody on their own device at the same time. And so it's really not having empathy, it's just not having that practice.
That's what I was gonna add on to, was that right there. As adults, as parents, we should be setting the example. And so the kids are mimicking a lot of times what they're seeing us do, right? Mm-hmm. So if we're at the dinner table and you're on your phone, what's wrong with them being on their phone? If you are sending a picture to somebody over here and they see it, why should they not be doing it? So a lot of times when we come, the kids are telling us what the adults are doing and what they've seen themselves, and so for them, that's okay, right? So if we're gonna ask them to do a certain thing, you also need to check what is your values for your family and for yourself.
So Annisha, you're saying that prevention also includes, as parents or guardians or adults in kids' lives, how much we're doing scrolling and how much we're using social media.
Absolutely, yeah. It's modeling, Do you remember the don't smoke commercials or the, no tobacco use commercials? I've heard so many parents say, well, I smoked because I saw my mom smoke, right? It's the same concept. Well, I'm using my social media because my mom sits at the dinner table and uses her social media up until she goes to bed. So absolutely, I agree. It's, I always ask the parents first, well, how do you model this for your child? what are your roles around social media and how much electronic usage you're using. Look at if you have an iPhone, you can see your screen time. How much time are you spending personally as a parent or a guardian on your screen instead of engaging and interacting with your child?
And the other part of like the prevention for us is they're watching you as the adult, but they're also watching their peers, okay? So whilst a lot of times we had a training and one of the research that was discussed was, why are kids not telling their safe person or adult, right? That's happening, but guess who they are telling? Their peer. So the peer will know about the exploitation or something negative that's happened. So what happens if, when you should be having these open communication, right? Well, if your child, her best friend or his best friend comes or a friend comes and they talk to them about something that's happened to them, what do they do with that information? Do they come tell you as the parent, or do they go tell somebody else that's a safe parent? So I think that's also to be preventive, have a conversation about what do they do if somebody comes and tells them about something that happened to them.
And I'm glad you mentioned that because we do talk about safe buddies in the classroom as well. If a kid is not feeling comfortable speaking to a safe adult and you feel more comfortable talking to your buddy, share that with a buddy. But we also say that even when you share with a buddy, an adult still needs to know. But I will add this. We're talking about the usage of parents and caregivers. One of the trends that we've seen is grandparents raising grandkids. Now, this is a generation that that's been told to us that is really having a hard time keeping up with technology because for a lot of them, they're not on social media. They're doing the very bare minimums of, being on the internet. And so sometimes it's also a kid being with someone that has very little knowledge about the internet space, but they know that, okay, well, you have a tablet. The tablet was given to you from a school or something to that nature. You must be doing all your schoolwork on that, but not really understanding what I want to say, the bandwidth of the accessibility of information for kids. So we have seen that as well for our grandparents raising grandkids.
So it's a different concept of the digital divide, right? There's a whole issue of the digital divide, but that's another way of thinking about it. We're going to transition to sort of interventions. What happens when you have a youth who is in it too deep or having problems, whether it's a legal issue or whether it's a mental health issue? Anything else that we missed about prevention that anybody wants to throw out there that?
I was going to mention just with the idea of like peers telling their friends these things. I think internet safety really just starts with like family safety in general of like parents, like know your kids' friends, like be invested in what's going on with their life, know who they're talking to, really take the time to like know them as a person and know where they're spending their time, know who they're hanging out with. Because that'll also open the door for some of those conversations where they might feel more comfortable talking to a friend, but if that friend, feels comfortable with another parent, that's another opportunity where we're really pulling the whole community together. It's not just the parent and the one child, it's everybody that's involved in this kid's life.
Last for me is sharing. Such a thing as oversharing online. I know you're proud of your kids, your grandkids, your cousins, but privatize your settings, right, to the people that you know, right? Putting a picture of your kid or somebody who's wearing their school shirt, okay, somebody can come across that, oh, okay, you go to this school, their age, your location. Everybody loves to do that too, right? I am here, I'm feeling happy, I'm over here at Chuck E. Cheese. And they know where you're at now. One of the things that we saw for HSI, our research studies, 19 seconds. That's the amount of time it can take for somebody to get the information of a youth. Privatize. Sometimes you don't have to share. You don't have to share. Send it directly to the person that you want it to get, but maybe not put everything online. For the kids, same thing with them, right? Putting your car online, the license plate, any information that can be put back to you, do not put it online.
I love that you mentioned that because I do talk to parents. What I say is dropping nuggets. You just dropped a lot of nuggets about your kid.
Cookie crumbs.
Yeah, the one that I love is like when a kid is going to kindergarten and they have that picture and that little chalkboard and it's like, Jimmy, he's 5, he's going to this school and his teacher is going to be, and I'm like, I'm like, you just dropped a lot of nuggets for a perpetrator to build a profile of your child. And I think that's the one thing that is in common with all of us, is that we know that wherever children are, that's where perpetrators are. So they're going to try to, have access in areas and gain trust from kids. And so the more identifiable information that you put out there about your kid, the more information you just gave to a perpetrator if they're trying to, basically groom your child or find out where they are or, make contact with them or anything. So a lot of times what I say to parents is that it's not always the kids. Sometimes it's the adults and the information that we're putting out there as well.
Thank you. So let's say we have a family that had a verbal contract about internet usage, social media usage. Their child suddenly is not doing well in school, is more moody, is complaining about peers, and as a parent, you discover that they are in bed with their phone until 3 in the morning. Not that that would ever happen. How do you then intervene? And again, I'm going to go back to the developmentally appropriate question as well, which is, my hunch is it's different with a 5-year-old than a 12-year-old than an 18-year-old, or 17-year-old. So whoever wants to jump into that.
Littles need 10 to 12 hours of sleep every night. And then actually we have this myth that teenagers don't need as much sleep as littles do, and actually they need more, especially during puberty. So if that were to happen, which never happens in my practice, of a parent finding their child up at 3 a.m. on TikTok, I would say take the phone that night if you can, tell them to go to sleep, have a conversation with them about it the next morning if you can, and then it's kind of individualized to each family, but my suggestion would be talk about it the next day, right? See if they can't improve their grades or whatever they're failing at first. If there is no improvement, then that's when that contract needs to come back out and say, okay, do you remember we agreed to this and I'm seeing you fail in this? I think it's a time for us to take a step back, right? And again, this goes back to parents too. So instead of allowing your child to have an hour or two in their room alone with their phone, why aren't we spending an hour or two outside at the park, especially now that it's nice outside, right? That can also help with depression, anxiety, spending more time with your children in person. I tell parents all the time too, right? Developmentally, it is a fantastic thing to sit down with your child a couple times a week at least at the dinner table with no social media, no phones, no electronics, and just ask them about their day. Mm-hmm. There are a lot of studies that show the more you eat a meal with your child, the less likely they are to engage in, risky sexual behaviors and alcohol and drug abuse.
Anybody else want to? Good, okay. And this was touched on a little bit, but speak about the balance of independence and socialization for youth, right? And again, my understanding is that adolescence, socialization is number one. With a 5 or 6-year-old, it's a different, while socialization is important, it has a different impact on their development.
Yes.
So how do you address those related to the safety concerns and the usage concerns?
So a lot of that is actually coming up in our clinic. I work at Norton Children's Medical Group on Broadway. We're in a pediatrics clinic. And I am having a lot of referrals for 1 to 5-year-olds about behavior concern. And a lot of that can be threefold, really. But a lot of it has to do with sleep, that child not getting enough sleep. And we're actually finding a lot more of our children are having speech delays. And a lot of that can be connected to parents kind of giving the phone to the child to kind of, have some calm down time for themselves, but they're not engaging with that child. And for speech, it's huge to talk to your baby, little, itty bitty, even when they're in utero. If they're not having that one-on-one conversation with their primary caregiver, eye contact, body language, showing smiles and frowns, and teaching those things, again, kind of going back to what Sarah was saying, they're not developing those skills later in life. So we are actually finding a lot of children, and there could be a million different reasons why, but a big direct link is phone usage. kids looking down at the phone instead of having eye contact with their parent or guardian throughout the day.
And play is a huge part of development for kids and even for teens, like being able to engage in creative activities, exploring different objects, having the time to interact with people and kind of create their own worlds in like just creative play is a really important thing. And if we're doing that on a device, it's not as effective. And so with kids, it's really, a lot of times with like kind of consequences of that, it's taking the device away. It's not giving that access to device. As parents, like we absolutely need our breaks. We need to be able to have time to kind of relax ourselves, make sure we're taking care of ourselves, but we need to find ways to do that that aren't just putting kids in front of screens. With teenagers, I do think it is a little bit more of a delicate balance because we are building those independent skills. They're going to be at an age where, they're going to be launching soon. And so it's not as practical to completely remove a device or to not allow them to have access to a phone, to a laptop, to a tablet. And so then I think it's a lot more of those nuanced conversations of boundary setting and taking personal responsibility and talking about those real life consequences of what can happen with that social media use.
Thank you. Pause for a moment and talk a little bit some of the myths. This is a little bit of a change in focus, but I know that we've talked about strangers quite a bit. I think there's some myths there. I know that we talked a little bit about, we're coming up on Derby time, which is a Louisville phenomenon that has some myths with it. So, Annisha, I'm going to turn to you as the Homeland Security investigations expert, and ask you to talk a little bit about some of the myths related to both social media and also exploitation that kind of circle around all of those pieces. If there's anything you want to.
Sure. So myth that I thought that got dispelled for me was like during high profile events, right? So like the Derby or Super Bowl, that human trafficking or like online exploitation would increase around these events. False. Because they're always going to happen. And especially when it comes to certain things, for the person, it's about money, right? So the Derby, prices go up, right? So we started looking at hotel rooms, different things, prices go up. They're not going to go get, the activity's not going to be higher because they're not going to make as much money. So that was a myth for us to dispel. Also, it was kids that are online being exploited or taken advantage of, they're the bad kids. They're the kids that have the issues. No. A lot of the kids, the youth that we come in contact with are kids that either are having issues in school, they don't have a large friend group, friend base, right? So online is safe, right? They've met people that they think accept them, see them, hear them. This is my really good friend. No, they know all about me. They agree with what I say. Oh, my parents don't understand me, right? So these are the kids that end up being exploited. There's also a myth that it could take weeks to months for a child to be exploited. It can happen within an afternoon. Those bad actors, right? We talked about oversharing. So you've shared what school your kids go to, what they like, all these things. The bad actor comes over, playing a game, or talking about Snapchat. Hey, you go to such school. I go there too. Oh, you do? Yeah, I'm in this grade. They believe that they're a kid. Mm-hmm. Hey, let's go play this game on this other chat group. They get them off of Snapchat or whatever they're on, and they're talking to them over here. That's how quick it happens.
So again, it gets back to the idea that strangers are not the problem, but how you define stranger or somebody you know, particularly for children sometimes.
Exactly. When I grew up, it was the white van, right? Be cautious of the white van. There are no white vans online. No, because a lot of times when we go and we're arresting these individuals, I'm thinking it's this person that's just looking disgusting, and it's really not. They're very clean cut. It's not what you would expect to be a perpetrator. So it is hard. It's hard for like we're sitting there telling the kids, do this. It is hard for us sometimes to see it in the beginning, to see those flags. Money, I will say this, if your kid has a Cash App account and it starts to grow with high value in the Cash App account, you need to be asking questions. Mm-hmm. I don't think any kid should have $1,000, let alone 100, unless this is coming from grandma or grandpa, right? But those are some signs that we've seen. My kids like Jordans. They like things. Kids like to go places. Some kids that don't have the income, that's how the perpetrators, the bad actors, they come to them on these games. Hey, you need $50 to upgrade to get into whatever game land? Oh my God, you're my friend. Thank you so much. There they go. Oh, you want to go here, or you don't have money to go to prom? I can help you buy that dress. Cash App.
Thank you. So let me circle this back for a minute, because I skipped a very important question that was on my mind. At least I think it was important.
Surely not.
And this is really answered differently probably by all of you from your perspectives, either as a provider or law enforcement or sort of an educator, kind of primary prevention specialist, which is, at what point as a parent do I acknowledge or do I recognize that the problem I'm having with my youth is beyond what the family dynamic can settle, can solve, and that we need to call you for law enforcement or therapeutic services or educational, at what point do I reach out? When does that happen
I know when we get calls, it's because an incident has already happened to the point where their parent is saying, I don't know what to do. And so the conversations that I have is to address the incident and the resources that may be available, but then also having that conversation about how to prevent it going forward. So we had a mother, she's actually based out of Florida, that called us. And she had a teenager son, and she just Googled us. And she said, I was just looking for an organization. You popped up because it said exploited children. And my son took nude photos, which, by the way, we have a lot of kids that are taking nude photos and posting them in that internet space, all the way down to elementary. School age kids. We had 3 elementary schools call us last year because kids were taking nude photos and posting them. But this teenager, he had taken some nude photos. Unfortunately, he was probably befriended by, or catfished, as some of us know, by an individual that thought was probably his same age. And then the requests started coming. Send me some more photos. If you don't do this, then this is what I'm going to do. If you don't send me money, this is what I'm going to do. And most of the threats are carried out by perpetrators. And in this incident, it was carried out. The perpetrator asked the teen to send him $300. The great thing is that he did not send the $300, but all the photos were released. And at this point in time, you have to think, when a photo is released, I mean, that could be for hundreds and hundreds of people to see that image along with your peers that you go to school with. And so the incident had already happened for the mom and the child. And so at that point in time, it's really talking about what is that safety plan. So the first thing that we always say is make sure that you include the school in what has happened. Because a lot of what the teen may have to face is going to come from within the school, from the peers. So the school needs to know what is happening. Secondly, we also need to make sure that we're reaching out to therapists. The mom had already made a police report. And then we also say make sure that you contact the National Center for Missing and Exploited Children. So a lot of times the incident has already happened when parents come to us. And then it's what can I do now? What should I do now?
I would say for parents with, in terms of like behavioral health providers, it's never too early to reach out. That as soon as you have a concern with your child, as soon as you even have a little inkling that something's going on, there's no harm in reaching out for a consult with somebody. Even if you don't end up pursuing full-on services, just reaching out and getting that support yourself, asking those questions. I think we could both speak to, like, we're never going to turn somebody away from our office. It's never, hey, like, it's too early for you. You got to wait till something happens. As soon as you have a concern, bring it in, get help, get support for yourself and for your child.
And also, you're not going to get in trouble. I think that's one of the biggest fears when we come across families, that they were very cautious and hesitant to tell law enforcement because either the parent thought they were going to get in trouble because their child had did this, or their child was going to get in trouble because the child sent the picture. That's not the case whatsoever, right? We are more concerned about the individual on the other end and what happened with that picture, and getting a hold of them, but not the child and not the parents, because you're coming forward and doing what you should be doing, and you're trying to protect your youth. With that, so thank you, Sonja. So you come forward, right, and you tell law enforcement that this happened, this occurred. We say, please, 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 do not delete the images. Do not delete, whether it was on your phone, the iPad, the laptop, don't delete it. I know we think, okay, we're delete, it's going to go away. No. So law enforcement will come in. We will get your device, right? Our very smart people will go and they would download, they would get in there, and they would get all the messages. They would go and they would find out who they were talking to, right? Those little, I'm not the IT person, but they're feed the IP address, wherever it's at. Most of the time, the person's not even going to be in Kentucky. Okay, they're not even here in this state. We've had somebody all the way in UK. We have a case from UK that we're working. So they were going, they would do all that, but we need the device. If we don't have it and you delete it, it makes their job even harder, okay, more difficult. We go to whether social media it was. We will say, hey, this is the account. This is what we got. Sometimes we'll even take over their account, and they will mimic them to get the other person. We can't promise that all those pictures are going to be taken down. We can't. Once they're out there, that's what we tell the kids too, they're out there, right? Even like Snapchat, and they think it goes away. A lot of times what we see is, it's on Snapchat, the other person has another device, and they are just clicking away, and they are copying that picture, okay? Also for us as a victim specialist, my notification to the parents and to that youth is, there's a chance that those pictures were sold or distributed. You have a right to be notified if we come across those pictures in another case. I've had people that are age 10, they're still being notified today at age 25, but their pictures are still being distributed. That trauma continues. That's what we try to educate and tell the youth, that right now in the moment doesn't just end there.
Thank you. I realize it's a little bit after 7:30, and so it's that time where I turn over to the audience for questions. So while Jim is grabbing the microphone, I'm going to go ahead and start with some of the questions that have been sent to us online. It actually worked. How about that? Starting off, some of you with sort of developmental, good child developmental knowledge. I want you to speak to this question. What age is best for a child to start using social media?
I hate this question, honestly. I dislike this question. Well, I think my parents more so always come to me and ask, what age is appropriate for my child to have a cell phone? Okay. I understand that a lot of children are using public transportation to get to and from school, and parents have, rightfully so, concerns about their safety. Parents laugh at me for this, but I tell them, your 5-year-old does not need a smartphone smarter than mine, personally. Now, get them a flip phone if you're that concerned, right? They still make flip phones, track phones, minute phones. Load some minutes on them, make sure that they can dial the appropriate, people, remembering phone numbers, those things. I suggest not getting a cell phone and or social media before the age of 10. And honestly, 12, if I could really, really, really tell parents, please just wait until 12 or 13 even. But unfortunately, that's not happening these days. It's going to be on a case-by-case basis, probably. It's going to be really up to the families, how much they can really trust their child. The cell phone contract or the social media contract they put together might help lead that, but that's my personal opinion. I would say nothing under the age of 10, really, if you can, avoid that. Because those age ranges developmentally are so important for children. They really are. They need to be playing and engaging, like we were talking about, Sarah and I were talking about. They need to be comfortable enough to form a relationship with you, a good talking, working, communicative relationship with you, instead of on a phone.
Yeah, I would say the longer you can wait, the better. that you're gonna get pushback. And as a parent, that's where you sit in some of those uncomfortable spaces of like, you know, it's my job to say no to this, and they're not necessarily gonna be super happy with you, but that's kind of the role. And then I think it's about slowly increasing some of that freedom over time while you're making sure you're still having those conversations and monitoring as a parent, having those safeguards in those apps and checking that and kind of slowly releasing the reins. I mean, if you can wait until high school, even like 16, 17, that'd be amazing.
I
But
need them to practice before that.
yeah, it's true. And that's where like you want them to be able to practice in a safe environment, right? So it's like if you're thinking about other things, you want it to happen in the safety of your home. You don't want to just release them and them have access to all of this without any preparation. But we really want to try to limit it as much as possible. And I think elementary school is a good hard cutoff that we're trying to wait at least until after that.
So that gets back to sort of a common rule of thumb that I've heard from parents is that as middle school hits and they're doing after-school activities, that's when cell phone usage increases. So here's the next question. Is sexting, and I'd like somebody to define that for the audience, is sexting common for kids? And if so, what age?
I heard a yes.
Yeah.
I would say, I'm going to say just from my perspective where I see it, it's been normalized. It is a normal thing to do. It is a common thing for the kids to do. I have seen it in elementary school.
So it's referred, vernacular that I often use is that an age-appropriate misbehavior. So it's a misbehavior, but it's common for that age group. Is that a fair?
Yeah. Okay. I think that's what you say, like that
So sexting is sharing nude photos. That's I mean, in a nutshell. But I agree. We are seeing that all the way in elementary school. And not only are we seeing kids where they are taking pictures of each other, but again, not understanding the dangers of uploading those pictures and sharing those pictures as well.
So at what age, because Annisha, maybe I misunderstood you, because I thought you had said it's pretty common, it's pretty acceptable behavior for that peer group at that age.
I think within the youth, what they see online and social influencers, that this is okay. That conversation is happening, that it is, I would say it's happening. I can't sit there and say all of them that a certain age group, but I'm saying I have seen it younger and younger now that is in elementary school that are now doing it.
Yeah, there's a perception of, showing your body. And again, when we say younger kids, understand that they also may be influenced by siblings or other things that they also see out there as well, and what they may see, and they're just mimicking that same behavior, that same action, but not understanding what the consequences are to that. But we are seeing it, when I started with ECHO, I mean, we were seeing sexting like high school. And like I said, within the last year, it is in the elementary schools. And these are babies. These are 7 and 8-year-olds that are taking pictures. One little guy, now I said the behavior was bad, but he was on to something. He was an entrepreneur. He was trying to sell his pictures to his other peers to have a look. So this is what we are seeing in the schools is not only are they taking the pictures, but now it's almost like they're sextorting each other, peer-to-peer type of thing.
Anything else about sexting? Okay. Here's another question related to to just technology, but not sexual abuse. Is there a link between children acting out violently with social media or when they have their technology taken away? So is there a link between violence in youth as a response to the social media or their access being taken away?
There's actually studies that show that, so I have a ton of boys that play Fortnite. I don't know if you all know what Fortnite is, or Call of Duty. In general, what you need to know is these games are rated M for mature. There are ratings on video games for a reason, but a lot of young children are playing these games. There are studies that show that there's no direct link to first-person shooter games and the increase of violence, especially in boys. But going back, we were talking about earlier, empathy, right? It's like our youth, our children are getting exposed to these experiences of seeing people die on video games, and then when they hear that things are happening in the world, they're kind of already, they've been exposed, right? It's not as shock-worthy to them anymore. And those social emotional reasoning skills, like what we really want them to be, aren't there because they're, can't find my words, but they've been exposed basically already to them.
Desensitized.
They're
to it.
desensitized, thank you. That's
Yeah.
exactly the word I was looking for.
Yeah.
Yes.
I think in terms of when the technology gets taken away, I don't know that I would characterize it so much as like a predisposition or more likely to act out violently, but that we're seeing a lot of emotional dysregulation. Yes. That it might not be violence, but it could be like just exploding with anger, like verbally. It could be breaking down into tears. It could be almost like having what feels like kind of like a panic response, that we're seeing just a lot of heightened emotions around it because there is that instant gratification piece of social media, that it's very stimulating. It keeps the attention. It almost can kind of function similar to other like addictions, that it's very rewarding in the moment. And so when we take it away, then we're seeing that really heightened emotional response to it. And it goes back to play too, that, you know, we don't have as much practice in regulating those emotions if we're just sitting in front of a screen most of the day. And so we're gonna see that kind of compounding on itself.
But I think the parent or guardian, you also need to be prepared
Yeah.
for that. Because also, when we come in and we're taking the device for law investigation purposes, and that later on I get a phone call from the parent saying that they are acting out, they're also acting out against the parent, so you go get them another device. So, right, they've learned, if I do this behavior, you don't want me to act this way. I've learned previously that you'll go and you'll do this, what I want you to do. So as parents and as guardians, right, we need to learn, educate ourselves, get the support that we need to combat that behavior when they display it.
But I think too, that can go back to when, you know, we're feeling overwhelmed as parents. It's easy to put a screen in front of the child to help them calm down. If that's what we're teaching them, it's going to feel like they need a screen in the future to be able to do that as well. Right. And so in that way, we're kind of setting ourselves up to be in that dynamic where I can't calm down unless I have my phone. I can't calm down unless I can play Fortnite and talk to my peers that way. So we want to be making sure that we're developing all the skills just outside of social media.
Yeah, and one thing that I would like to also bring into this conversation is we are seeing more kids that are being exposed to pornographic images as well. And so we have been contacted by schools to even help kids to identify what healthy and unhealthy relationships look like based on what they may have seen on these devices as well. So that also has an impact on their mental well-being, and really just trying to decipher what does a real healthy relationship look like. One of our studies shows that one of the most searched words by an 8-year-old is porn. And I always tell the parents, again, you know, if you discover porn on a kid's device, don't overreact, because sometimes it's not that they went looking for that. Sometimes that information comes to them. If you misspell a word, you know, it can bring up other images or other ads and things of that nature. And so again, this is why we want to really create safe spaces to have those types of conversations so that kids can feel comfortable, that when they feel uncomfortable, that they still know that they can come and speak to you, or at least speak to a safe adult that is going to hear them out and, you know, again, provide that safety net for them.
And remember, kids are naturally curious, right? Yeah. So they're going to look for things. They're going to want to ask questions, and sometimes it's just not to their parents.
Bless her heart, she's still standing.
Yeah, she's ready to ask.
Wait a minute, Chan, I'm sorry. Give me one more second, because there's a question here that dovetails on where Sarah left off. So let me do that, and then we'll come back to you. I'm sorry. So it was as if you were reading my text messages. So a question from the audience is also, what is your professional opinion about tablet babies or kids who have grown up with a phone in their hand? And then I promise we're going to come to you. If you're one of my bosses, we have to.
What is my opinion about it? It's always a little scary to me when I see a 2 or 3-year-old that can work their parent's phone as well or better than their parent. I would just say in those cases, like encouraging as much free play that's not technology-based as possible. Get your kids outside. There was actually, I saw this the other day, there was this like study that came out of Norway that like most kids need 3 hours of outdoor play a day for like optimal development. I'm not totally sure where they got that number from, but that's a lot of time. And if you're thinking about that, that's like from the time they come home to school till bedtime, that's a lot of time that like they would be spending outside, that if we're starting that early with technology and, you know, we're getting a couple hours of tablet time or phone time a day at like in that toddlerhood, what's it gonna look like when we're in elementary, middle school, high school, and we're getting more of that freedom? If that's what they know, they're gonna stay there. And it is that, it's a very rewarding system for the brain. It's a very stimulating, very exciting thing. And there's always the curiosity, there's always new stuff to see and new stuff to explore that that's a hard pattern to break. So like we were talking about before, the longer you can kind of delay those exposures to technology, the better.
Part for me, though, is like the curiousness, though.
Yeah.
When it comes to the adult that's giving the child the tablet. Because when we come in, and yes, my focus is the victim, which may be the minor adult that's been victimized. But not only that, I'm also assisting the parent. So what we come to find out is the parent is stressed. The parent has a lot of other things going on with them. So not only do I have to focus on the victim, I also have to focus on the parent. And so the parent may be, right, we talked about taking care of yourself. If you're overworked, you're not getting enough sleep, you don't have a break, you don't have a good support system, guess what you're gonna do? You're gonna give the child the tablet because you need 5 minutes to yourself. So we've got to start asking those questions, why, and what can we do to help you better on that end too?
Yeah, so we're talking about all sorts of systemic supports in that way too, that we're seeing a lot of parents trying to parent in isolation, and it just doesn't work.
Whether financial reasons, whether it's, you know, abusive relationships, a lot of things that are around this, the reasons of why kids are also being victimized.
Dan, go ahead. Thank you. So, thank you for your
I
patience.
promise it was worth it. No, it was worth it. I'm serious. Thank you. And thank you for, you know, being here and doing this discussion. I actually just had a question about AI. Just because this is really helpful. I am someone who's on TikTok. I video game. I try to have good social media hygiene with my kids, not always. But lately, so I use ChatGPT a lot in my work, and I've let my children, with my supervision, like ask it questions or like put their spelling words in there to help it make a story. But one of my children has asked to use it, like, Mommy, can I ask ChatGPT a question? And I know like deep fakes and all this stuff with AI, so I'm like very leery. And I'm like, how do I approach this with her when we barely have like a social media plan in general? But like, how do I like say, she wants to use it by herself. And she did, I let her, and it was like age appropriate question. It was like, what are rainbows made of or something? And that's like innocent and cute, but like, how do I approach letting her use like AI or technology like that, or a chat bot, or, you know, things like that? I'm like, yeah.
Can we talk about what AI is?
Complicated.
I know, it's to go.
I will say AI is very brand new, and we are still learning about it as it evolves. As law enforcement, I do know there is a case in Kentucky, I'm sure you saw that was on the news, about an individual who used AI for images of CSAM. So we are learning about it as it evolves, and is, again, out there. Y'all want to talk on that one?
I would just mimic what you're saying. If you remember, I opened up saying that this is a very fast-paced environment. And so we too are learning about AI because this is a new piece of technology that you can utilize. I don't think we have learned enough because it's still developing. I use AI for one of my committee meetings, and I'm like, oh my gosh, like this is amazing, but at the same time, it's also a little scary that someone's recording and then, you know, putting my words into your own, you know, type of paragraph. So it's very new. So it is going to be one of those things that, you know, never hesitate to jump in and do some of your own personal education. Google is always a good friend of ours, so that we learn a lot. But the people that are experts in AI, if there's ever workshops or anything like that, I would say, definitely enroll, but it is fast and we're still learning it too, all the parameters
Yeah,
around it.
so we have C3 for us that really does a lot of our cyber, right? And so that is one of the things that they really are diving into right now. So we used to have what we called iGuardian for safety for kids online, but now we have just updated. I'm so excited because it looks so good. It opened up today called Know to Protect. So if you were to go to dhs.gov, the / thing, right, and know, #2, protect, on there is a new resource for AI. And so that was
I'm
just
sorry, Annisha, is it no as in N-O or no as in K-N-O-W?
KNOW. And that was just uploaded today, to just release it today, but there is a new section I didn't really get to peruse on there today for AI though. So again, that's just one of those things where I would say caution first. I have kids and they ain't doing that. I'm gonna wait to see more stuff, more information about it before.
And I would say like that approach that you're taking of supervising and just kind of seeing how it goes, and then you're slowly progressing. And I think one thing that we haven't really mentioned so much before, we've been talking about like a lot of the problematic behaviors, is praising the positive behaviors that you've seen. Of like, if your child is looking up appropriate things or using it appropriately, like praise that, encourage that, like make sure that they know that what they're doing is okay. Because it's the same concept that we don't want to be only addressing the problem behaviors. We want to be making sure that we're praising the good behaviors.
Even somebody contacted them and they come and tell you.
Yes.
Yes.
Encouraging that and really like building that up. And so like looking up rainbows, that's amazing and that's beautiful. And just kind of reinforcing of like, this is how we use this. This is what we want to make sure this is, kind of the safety parameters that we already have. And as they get older, like sharing more of that rationale of why.
So along with the contract that we've talked about, you can also talk about being a good digital citizen. And that is a great way, again, to have agreements between you and your child, but then also a very great way to praise them as well. So being a good digital citizen. With kids, we talk about being upstanders and bystanders, and, we see a lot of fights that are being recorded. So if your kid comes and shows you a fight that is being recorded, like praise them. Thank you so much for sharing this information with me. And then immediately contact the school so that they will know what's going on.
We have a question, Roger.
Oh, I was just wondering if you could give us a few practical tips for what to do if we are at work and we receive an email that someone has nude photos of our child or teen that they're going to release if we don't pay a certain amount of money. I've heard about this happening to parents in this community, and I'm just wondering what steps should that adult take if they receive that kind of email?
So that's what we call sextortion, right? So if somebody has an image or they're saying they have an image, okay? Definitely right then and there, I would contact law enforcement. Okay, they can look in there. If their image had been sent, they're going to see exactly where that email address was sent from, and they're going to investigate it. There is nothing that I would say you need to do, contact the other person, even do anything of that nature, because bottom line, if they've got it, they're going to send it, they're going to send it. But bottom line, sextortion, a lot of times, they just want the money. They're going to scare you thinking to get the money. Even if you paid the money, they're going to come back and want some more money. Mm-hmm. So contact law enforcement immediately. Don't delete the email. Don't delete the email, shut it down, contact law enforcement, let them see it, let them go in there and do what they need to do.
Well, hello. Thanks so much, and it's been wonderful. I work with refugees mainly and some immigrants, and I was talking with this lovely lady, and she says that you go to schools, and talk with the kids, and sometimes reach out to parents. I was wondering if, and she said that you're planning to go to newcomers. Because my concern is that I work with adults, but of course there are problems with the kids. And our refugees, they already deal with so much stress, and I work specifically the ones that are being tortured. Mm-hmm. So it's PTSD and you name it. They are so out of the loop about this culture, and so for them, it's very hard to understand what the kids are doing, and they have a language barrier, and we have a lot of problems with human trafficking. They surround the girls specifically, but some boys as well, around the schools. So the parents come to us and said, my daughter, has a new phone. She has a new this. I don't know who gave it to her, So I was wondering if Newcomb would be one of the schools and how, you're such a small organization, but what kind of resource can you give the parents with no language, a language barrier, and I cannot even list the number of problems that they have, to address.
Sure. So for us, part of it, so Homeland Security investigations, we are under the umbrella of ICE, but we are separate because we do the investigation part. But part of that also is, especially what everybody sees what's happening at the border, one of the bigger issues that we have is that we have unaccompanied minors that are coming across and being sent to a sponsor or family member that's located here in Kentucky. And later on we find out that that may not be the family member that's there. And so minors have been exploited and are being trafficked. But you can also be here in Kentucky and be trafficked by a family member. All right, so for us, if it's under the age of 18 and it's having a sex with an adult, that is human trafficking. For an adult, it is force, fraud, or coercion that is being used that would, either something of value that is in exchange for that person. That is human trafficking for 18 and above. But for you, definitely contact, I can give you my information, me or my partner will come out. We use interpreters, or we will get somebody, because we also work with a lot of NGOs within the area, and come and do some training, do some education, because part of it also is there's a cultural difference, right? So people that come maybe we have individuals from Guatemala, from Mexico. There are things where there's an age we've had parents that are like, oh, my 12-year-old, it's okay for this 21-year-old because some things are culturally, it's okay, it's accepted in their region. So we have to understand that and explain, okay, things are differently here. That's not a problem or issue whatsoever. We will come out and do that education, do that piece. But just like you said, having the cell phone, having those new things, those shining things that come out, that is for us, we call them like flags. We're like, oh, hold on a second, let's ask another question, what's going on there? So definitely though.
Oh, okay. Thank you all. So we have a 7.5-year-old in elementary school, and does not have social media yet, does not have his own phone, but he does have a Nintendo, so we're already managing that. But I have kind of a two-part question. So can you talk a little bit about tools that are out there for parents to monitor their child's activity online? And do you recommend that parents do that and maybe like put it in the contract that if you're gonna be on social media, I'm gonna be watching what you're doing? And then the second part of that is, now that he's in elementary school and there are different activities, there are things that happen on social media that other adults do, like the school, that we don't have control over, or it feels like we don't. So what authority do we have to intervene in those situations, even if it isn't unsafe, like on the surface? How do we work with our schools and our teachers to not have our kids' faces everywhere online?
Okay, everybody's looking at me.
Good.
Again, I think
schools. Go ahead.
yes, we're all together. So there are many parental apps, and just as we are saying that it really is based on your own rules and regulations. I don't like to say this or that is better than the other, because it really depends on your own environment that you've created, the type of relationship that you have with your kids. But just to throw out a few, there's one that's Life 360. That is a parental app that we have heard a lot of good feedback on. There's another one that's called Bark. But again, you can Google parental apps and Some are free, some cost, and that's why I don't like to just throw out a whole, this is what my favorite is, because it really is based upon your environment, what you're creating, what you're wanting to monitor. Another good resource, it is called commonsensemedia.org. With Common Sense Media, not only can you put in games and see what the ratings are, but you can talk about movies and all those good things as well. And it'll give you recommendations for age limits, who should be seeing this, who should not be seeing this. Anyone else have anything to add?
I was just going to say, if you do create a contract with your child, also include words that they are not allowed to use. For example, sex, porn, all the keywords that you highlight, suicide. There are apps actually too that can track for preteens and teens. If they use any language around suicide, it will alert the parent in the parent's phone right then and there. But I would say make a contract and put those specifics in there for your child, and talk about it. With a 7-year-old, a lot of it is just going to be talking about the do's and the don'ts, really. Even if it's written down, they're not going to really read it. But, and in general, kind of going back to what we talked about today, you're the parents at the end of the day. You have to decide what you feel like is best for your child. And don't feel pressured to give your child a phone or access to social media just because their friends have it. That might not be the best thing for them. And you're actually the 1 in a million parents who are not going to allow their child to have social media until a certain age, but that's okay. And honestly, I would encourage that.
Go ahead.
I would say you asked the question around, do we share that we're tracking that? I think especially at an early age, and I think across the board, we want to have that upfront honesty otherwise it can feel like we're being a little bit deceptive or like we're sneaking behind their back. We're asking them not to do that. So being upfront of hey, this is the contract, we're agreeing to this, we're gonna be checking it regularly, and then this is what happens if we check it and we find something, because then it's all that upfront. It's not the unexpected, oh, I didn't know they were gonna see that, and I didn't know I was gonna have consequences for it. If we set it up in advance, then we're showing them that cause and effect piece, and we're able to maintain those boundaries and set the expectations and structure. And then with your question around schools, I think it's completely within your right as a parent to advocate for what you want for your child. And it, ideally is that cooperative relationship with the teachers and with the school. If something's being shared or posted in a way that makes you uncomfortable or that you would rather not do it, I think it's completely okay to go to that teacher or to administration and say, this is what we're setting up for our family. I would really appreciate if my child was not included in this, and we don't want that in the future.
And that's a nice actually reminder that I'll give to you all, that at your table, at your seats rather, are calendars of upcoming community chats, because this year, our focus this year is again on our youth and how to raise resilient youth, whether it's about social media usage, whether it's about gun violence and violence in the communities, or whether it's about substance use. So these are things that will be topics of conversation throughout the year on our community chats, and you have that calendar there. I want to say thank you to each of you. I really appreciate. I have to pause because Sonja and I've known each other for a long time, and when she wants to talk, I need to let her.
Yeah. Well, because I think there's just a couple of other things. Education. Our kids grew up in a digital space, and so for us, we got to educate ourselves. So reach out to organizations that provide this education for children and or for adults. The other thing that I want to say is that we say for kids to talk to their parents, but to be quite honest, there's some kids that are not going to talk to you. So we need to make sure that we have a conversation that kids can identify a safe adult that they feel comfortable sharing that information with. So again, we're building in all those protective factors for that kid. I was not so open to talk to my mom about certain things, but I had an aunt that I could talk to her about anything, and of course they would communicate. But I wanted to be very clear that when we're saying talk to your kids or have your kids come talk to you, that may not always happen.
Right,
but give them another opportunity.
Over time. There's times when our kids will talk to us and then times when they won't, or specific situations in which they won't.
Exactly.
So that's a very good point.
Just one piece of with that, don't try to parent in isolation. that the question before, it's never too early to reach out to get support, whether that's behavioral health, educational resources, advocacy resources, the school. Get as many people, safe adults and safe people involved in your kid's life as possible, and stay connected within that community, because they're more likely to have that person that they can go to. And while yes, it's your responsibility as a parent, you don't have to do it by yourself. And I also don't think we're meant to do it by ourselves, that we're meant to have people around us to support us in that.
Yeah, it takes a village to raise children. Just remember that.
And we're now part of that village for you.
Yes.
Well, thank you very much for your time, and thank you all for being here.
Thank you.